Thank you much. What is a joint? A joint is essentially where two bones meet. It's as simple as that. Very, very straightforward. Um, and then we get to this next screen. How are joints classified? So it's ultimately by how they move and what they're composed of. Starts out very easy, gets a little bit more involved in the next few slides here and so on and so forth. Some joints provide structural support, others let you move. Again, very basic to start. We're just going over definitions at this point. So now kind of getting into what are joints made of. So joints are a combination of bones and the connective tissue around it. If a tendon connects muscle to muscle, a ligament connects muscle to bone, and so they're all kind of form the capsule and the shape of joints themselves. And then also there's nerves and blood supply, things like that. Very, very straightforward, very easy. But we can also classify by how much of that connective tissue they have. So there's three different types of joints, three classifications. There's the fibrous joints. They're not very flexible. They essentially have this very thick fiber around it that kind of keeps things from moving. An example of that is actually the skull. Because when you're born, you have 220 bones. As an adult, you have 206 bones. You don't all of a sudden just lose bones. They just actually start forming together. That's why babies have the growth plate, and things kind of form together to include the skull. Babies have that soft spot as they kind of merge together. It's a joint. Two bones meet, but it's not typically thought of as a joint, but it is technically meet that criteria. Other examples would be the shins. There's two shin bones, but there's this fiber that's wrapped around them, kind of connecting the two, so it almost acts and functions like one bone. But again, two separate bones. That's where what the joints are. Then there's a cartilaginous joints. That's essentially where they have a little bit more flexibility, a little bit more movement, but they're kind of formed together with more cartilage as opposed to that fiber. The best example of that is where the ribs connect to the chest bone, the sternum. There's an area of cartilage on each side. Sometimes that can get inflamed, but that's the common area of cartilaginous joints. Another common area is the pelvis, and that's key for childbirth. It needs to have a little bit of stretch, and then kind of goes back and returns back to that normal shape. So that's that cartilaginous joints. But by far the most common, the most well-known are the synovial joints. That's the joints that involve moving the arms, like the shoulders, the elbows, all the joints in the fingers, the hips, the knees, the standard joints that people go, now we're on the same page. So what they have is they tend to have a little bit of bone with a area of cartilage at the end of the bones. It helps it move. It also has the bursa, kind of a fluid-filled sac that allows it to slide over each other without actually causing much friction. So that's kind of where the main part of this conversation is going to be talking about. And please enjoy while you go here. Okay. So the main types of synovial joints, we have the ball and shoulder. It is the one that gives us the most range of motion. It's the shoulder. Ball and socket, the most common is the shoulder. It gives us significant range of motion, but it's also one of the areas that's least stable. You can potentially dislocate like a shoulder joint, and so that is part of the, trade-off. You get a lot more mobility, but they're not as supportive. The hip are also that ball and socket joints, but because of where it's positioned, it's a little bit deeper into the pelvis. There's a little bit more support with that. Then we're also looking at the hinge joints. The most common are the elbows, the knees. They can go essentially move in one direction. Pivot joints, the neck is the most common, and then there's joints in the wrist, that just allow it to slide over. Those are called plantar joints. There's the one that kind of allow you to move the wrist in different ways, move the forearm. So those are the main types of synovial joints. And kind of touching on this next one, the muscles' role in joints. So the muscles kind of form a supportive network. Bones do a great job. They hold up all the weight. They hold up all the force. They're perfect for that. But they also need a little bit of support, and so that's where the muscles help as well. And so muscle strength correlates directly with joint strength. If you do not have good, strong muscles around the joints, there's a good chance that the joints may be weak and may be not functioning as well as they can. And so you talk about anybody, my knee's hurting. Well, maybe you need to do some physical therapy, work the areas around the joints. It kind of helps build a little bit more support, kind of gets things working a little bit better. Bones, muscles, they get a great blood supply. They get direct blood supply. All the extra areas, the cartilage that's kind of on the end of the bones, don't. They don't get a good blood supply at all. They just kind of get the leftover blood as to what's around. The nerves essentially go to the bones, they go to the muscles, and they bypass a lot of the cartilage. This is important because of this next reason, where as individuals start getting a little bit older, they may come across something like this, osteoarthritis. This is what people think of when they think of arthritis. It's also known as degenerative joint disease. It literally, things just start wearing down. That cartilage level starts wearing down. But because, like I just said, the blood supply and the nerves don't go to the cartilage, you may not feel it. You may not feel it initially when you're starting to get that initial levels of wearing down. You're just like, oh, I was told I have arthritis, but I'm feeling great. I'm not having any concerns. That's those early stages. But as it continues to go on, it starts affecting some of the nerves and the bones themselves. It starts affecting the blood vessels. It starts affecting the muscles. And that's when people go, this is not pleasant. I'm definitely well aware of it. You start getting the changes in barometric pressure. I can feel a storm's coming on. It's coming. It'll be here by 6 o'clock. I know, because my knees started to hurt and so on and so forth. So you start getting that cartilage damage, and you start getting some of that thinning of the cartilage. Wear and tear injuries, increasing age, old injuries from sports, trauma, things like that, or carrying a little extra weight. Those are the major risk factors for developing osteoarthritis. So like I was saying, you get a little bit of pain, but it's usually at the later stages, not at the initial stages. You may get a little bit of morning stiffness, but actually a little bit of rest can help, but also a little bit of movement can help. We kind of have a fine balance. You get a little bit of morning stiffness, you start moving, it starts feeling a little bit better, and then when you move too much and it starts hurting, that's when you kind of rest, and again, it starts getting a little bit better that as well. All right, kind of touching on a little bit of pictures of arthritis. So what you're looking at is the knee joint, and normal knee joints on this side, and then the abnormal where it's starting to get inflamed, starting to get a little irritated, and you clearly see that there's areas where that tend to rub up against each other. You might get that bone-on-bone description. All right, so next condition, rheumatoid arthritis, also known as RA. This is a situation where the body looks at its own joints and says, there's just something not quite right, and attacks itself. And so this tends to be a little bit more severe. You can get deformities of the hands. That's one of the more common areas of rheumatoid arthritis. You can potentially get it in the feet, the knees, and so on and so forth, but by far the hands are one of the more common locations. It tends to have a little bit more of that morning stiffness. It tends to last a little bit longer, a little bit more severe, and it's unpleasant. I guess would be the best way of saying that. Usually, these are the type of patients that need the anti-inflammatory just to get moving, just to kind of get started. They need a little bit more. Because it's an autoimmune condition, the body attacking itself, it doesn't focus on one joint, it tends to focus, or distributed to both sides of the body. And it can lead to, again, more that cartilage getting destroyed and can affect the bones, actually causing some of the deformities. Okay, and gout. So gout is, it used to be known as the disease of kings, because what happens with that is there's inflammation, there's tiny little crystals that are the breakdown from either excess alcohol or or excess meats, or shellfish or organ meats and so on and so forth. And so it kind of turns into this nitrogen into tiny little crystals that get stuck in the joint, and it lets people know real quick. The joint tends to get red, it gets swollen, it gets hot to the touch, and it is painful. The most common location is at the base of the big toe. And some people don't like wearing socks, shoes, a bed sheet touching it, and they're practically hitting the ceiling. It was known as the disease of kings because at one time they were the only ones that had access to the gay meat and the higher levels of meat and the alcohol and so on and so forth. So there's just that combination. So for those individuals that do have gout, you're part of the kings. However, it still is an unpleasant thing, but it serves as a reminder. Well, maybe I should make some changes to the nutrition, maybe changes some to the exercise, and kind of help prevent a lot of future gout attacks. All right. And so medical treatments for various joint conditions. The most important thing that I could ever say during this presentation, during any presentation, is a conversation about joints, movement is the most important thing, by far. Hands down, it is vital. As somebody sits or doesn't use a joint, they will actually lose some of the function of it. So being able to move is going to be one of the best things. So that's going to be a sign of a healthy joint. There are some options that can be treated. Oral medications tends to focus on anti-inflammatories. There's topical treatments as well. There's injections, and then there's various forms of injections as well. And then there's some of the supplements as well. Glucosamine, chondroitin, that they're kind of two naturally occurring substances and put together. Some people swear by them. Oh, this is the greatest thing since sliced bread. Some people say, I appreciate that it works for you, but it's not my favorite. With any of the supplements, it may take a little bit longer, just to notice that effect. There's a hyaluronic acid, which I also included as well. That's kind of that another naturally occurring substance, but this is the one that tends to be injected into the joint. It's kind of more of a gel form. The idea of it is to kind of help stimulate some regrowth of some of that cartilage. It can work for some, and some people, again, this is the greatest thing. But again, it just tends to take a little bit more of a prolonged course. So that tends to be those. There are other options of what you're injecting, whether it's the steroid medicines. The idea of that is to kind of calm down that inflammation. And then there's some other ways. PRP, which is platelet-rich, platelet-rich therapy, PRP. I'm missing the P. But anyway, it's essentially using your own blood supply. You kind of filter it off. You take a little bit of the platelets, platelet-rich plasma. So you take a little bit of that plasma, and you cause a little bit of an injury, but the idea of it is to stimulate regrowth. So all the healing cells are now coming into it and kind of trying to work with some of that, cut down on that inflammation. It's a little bit more of an involved process because you have to draw their own blood, use it in a centrifuge, kind of spin it down, but it tends to kind of prolong the course, but it can work well. The most proven area are the knees. But for people on blood thinners, gotta be mindful of which anti-inflammatories and so on and so forth to touch on. Okay. And 5 signs of healthy joints. Being able to move throughout the whole range of motion, that's going to be key. Being able to stretch and have some flexibility, that's another sign. Strength, being able to actually use the joints. Making sure that it's nice and lubricated and it's not. Obviously, those are signs of healthy joints. and not having pain. Pain tells you what's going on. If you're not having pain, that could be a sign of a good joint. And so obviously that's our goal, is to get people functioning as much as possible. There may be levels of, you still have some pain, especially at some of the severe stages, but our goal is to keep people functioning, keep people moving. That's, like I said on the last slide, movement is vital. All right, so looking at some of the exercises that I've included, my favorite, hands down, probably what I consider the perfect exercise, swimming. Swimming and or getting in the pool, doing the water aerobics. The water allows, kind of takes some of the pressure off the joints, so there's not that pounding type of thing. Low impact exercises are also tremendous benefit. Biking, going to the gym, walking, any of these exercises that you're doing, stretching, all are important. We try to avoid a lot of that pounding motion, so a lot of the jumping, a lot of the running. I think those are great exercises. I think they can be tremendous benefit, but for those individuals with significant arthritis, they tend to steer people away from those. But if you can handle it, I think it's all a great thing. But again, working the muscles around the affected joints is key. Yeah. All right, so home techniques that may help with inflammation. It's so known that, excuse me, I'm going to have to get there for one second. There's nothing.
Do you want me to sit there, Jim? Thank you. Travel on Sacred was took me an hour and a half. That usually.
Excellent. Cool. And so just kind of leading off with the home techniques that may help lower inflammation. This is where you know that there's an inflamed joints, and so what can we do to kind of help lower the inflammation? An anti-inflammatory diet has been proven to actually lower levels of inflammation and get people to feel better. It may help with excess weight as well. One of the best approaches, Mediterranean diet, very, very common. And then there's DASH diet, which is the dietary approach to stop hypertension or stop high blood pressure. Both then have an overlap in the sense, and as well as the vegetarian, vegan diets as well. But there's a lot more focus on lean proteins, a lot more focus on fruits, vegetables, healthy oils, including olive oil and such, limited amounts of alcohol, all of the limited amount of sugar. All of these are known to lower inflammation, hopefully get people feeling a little bit better. So yeah, like I said, there are differences between all of these, but most importantly, the similarities is that everybody's eating food that they recognize as food. It's not, you're looking at the back of the ingredients and going, no, I can't even pronounce any of those things. It tends to mean it's a little bit more highly processed. So you look at it and go, I know what this is. This is clearly on the ingredients. Those are kind of what tend to have the best benefits in lowering a lot of the inflammation that's present. Cutting back on sodium, cutting back on sugar, and cutting back on fat, processed foods, all of those can be beneficial as well. Some spices are actually known to have some anti-inflammatory benefits. Do you want to make sure that you're discussing it with the doctor, make sure that there's no interactions with blood thinners or cholesterol medicines or whatever the case may be. But turmeric is one of the most well-known ones. If you are doing turmeric, adding a little bit of black pepper allows it to absorb a little bit easier. Otherwise, the turmeric doesn't actually have as much absorption in it. Ginger, garlic, those are also known to have a lot of anti-inflammatory benefits as well. All right, so kind of here's an example of the Mediterranean diet. We're looking at salmon, we're looking at nuts, we're looking at olives, we're looking at peppers, we're looking at tomatoes. And yeah, so we're just looking at a wide variety of things, not very herbaceous and spices, so all beneficial types of things that can help lower the inflammation levels. So some just tips, just overall, just what can we do? Wearing high heels tends to put a little bit more stress on the ankles and therefore on the knees and the hip. It's kind of a whole long chain A 3-inch heel puts 7 times more stress on the foot and ankle than a 1-inch heel. So, and obviously, stilettos are put a little bit more pressure than like wedge sandals and so on and so forth. But just that elevated position kind of puts a little bit more stress. It can change the angle of the joints and put a little bit more stress on the knees, for example. Going to the salad bar, hanging out at the salad bar. Romaine, big lettuce, broccoli, spinach, kale, parsley. All of these green leafy vegetables can be helpful, and herbs can be helpful to actually help with inflammation, and also they have high calcium levels. So this can also be of added benefit as well. All right. So again, touching on number 3, moving around. That is by far the best thing that I can recommend. I should put it as number 1, but just kind of snuck it in there to remind people. By far one of the best things we can do. It helps prevent the stiffness. It also helps prevent strain. We don't want people sitting too long. We don't want people standing too long. We want some people just to actually be moving. It's going to be one of the best things you can do. If your job does involve mostly sitting, try to take a break every 30 minutes every hour, get up, move around. It's going to be one of the best things. Kick butt. So this is, smokers have a greater risk of fracture than non-smokers. Obviously, fracture, I haven't touched on this exclusively in this presentation, but fracture is a concern. And so I want to make sure that if we can lower the risks of fractures, lower the risks of damage like that, that's going to be a huge thing for protecting the overall health. And so getting up and moving, we want to make sure that people are getting up and moving and not going to go smoke. That's not the trade-off that we're looking for. So we want to make sure that cutting back or ultimately quitting smoking, that's going to be one of the healthiest and best options that can be done. Any extra pound of weight that somebody's carrying puts 4 pounds of more stress on the knee than somebody that's at regular weight. Flip side is that even a small amount of weight loss will give your knees some rhythm and the other joints as well. You lose 11 pounds and your risk of arthritis drops by 50%. So just a small change can make a big, big difference to taking some of that extra pressure.
Could you repeat that? You said
if you lose up to 11 pounds, you may drop the risk of developing arthritis by 50%.
what if you already have arthritis? Would it's there.
There will be, with arthritis, there's no specific cure. And so it's slowing down the degradation, slowing down the wearing down. Weight loss can make a big, big difference.
So if you already have it, if you drop a few pounds, it's going to slow down.
You're going to be feeling better, you're going to be moving better.
And it will slow down
the breakdown of the bones itself. Yeah, that's a very appreciated and helpful question. But yeah, that's going to be one of the best things that we could ultimately recommend. Take the plunge. Like I was talking about, my favorite and perfect exercise, swimming or just getting in the pool, because it takes some of the pressure off the joints themselves, and as well as just giving you that flexibility and range of motion. This is something that's can go either way. This next point, warming up. It is important to warm up, especially in winter, especially when it's cooler. You do want to get a little bit of activity before you start getting into more intense activity. So that's going to be important. Definitely want you to kind of ease into it. And then you can kind of ramp up the intensity, do a little bit more. But where it gets a little bit tricky, everybody tends to think, or most people tend to think, stretching before is the most important. Stretching after is actually the most important. While after you've warmed up, that's when you do a little bit of stretching, you get the best benefit, you get the most range of motion, you get the best effects from that. But still want you to do a little bit of stretching beforehand. But if you're going to focus on it, focus on the ones after movement and so on and so forth, after warming up. That's where it's really going to be.
So if you don't mind me interrupting with questions.
Sure.
If you were going to go for a walk, let's say, what would be a warm-up prior or stretch that you would suggest
Okay, fair.
prior to walking?
So I think walking is absolutely a perfect warm-up in and of itself. If you're going to, I'm thinking of going for a little bit of a jog or a little bit faster walk towards the end. There's just regular walking. That's an absolutely great way to just loosen up, get the blood flowing. But I wouldn't want to say, oh, I'm just going to start by jogging, or I'm going to start by walking as fast as I possibly can.
No, but I know, I mean, when you obviously, you go for a walk, you start out and you build up your speed.
Exactly.
My question is there any sort of little stretch or something to do to prepare your body for even the slower beginning of the walk?
So kind of making sure you're stretching all of the major joints in the leg. So for example, I'm going to be turning my back to the camera, but going up to the side of the wall, this will stretch your calves. Kind of stretching it like this, where you're lifting that up. That's going to stretch the calf. Holding on to something, stretching just kind of stretching the knee and the thigh. So this can be helpful as well. But again, holding on to something, you don't want somebody to take a tumble, and again, doing both sides. Eventually one foot in front of the other, a little bit of a stretch this way. We'll kind of work a little bit of the hamstrings, a little bit of the thighs as well. So all of these are just basic kind of things that you can do to kind of keep moving. Again, that's what we want. The ultimate goal is. So just some light, gentle stretches, those are going to be helpful. And then as you do a little bit more of the exercise, you can continue that. You might even notice that when you were doing this at the beginning, now you can go a little bit further and feel a little bit more of that stretch afterwards.
So again, along those lines, when your muscles get really tight, like what you just did with lifting I can't do that with my left leg.
That's fair.
So what do you do for muscle tightness to help loosen them up a little bit?
So that's, again, starting to warm up. And as you're doing some of the warming up, that's where the stretching afterwards tends to have a little bit more of that effect, where muscles tend to loosen up a little bit. There are some other options that could be done. Sitting down, for example, and pulling the leg up will also give a little bit more of a stretch. So there are alternatives to, if that doesn't work, then kind of finding an alternative that may work.
But I have very, very tight quads, very tight, very tight. And I get on the floor every morning and I stretch.
Okay.
But I can't loosen these muscles up. And I'm wondering what I can do, if you have any thoughts about that.
So that's when we start getting into the recovery phase of things, because there tends to be a natural imbalance between the front of the body and the back of the body. Front of the body tends to be stronger, back of the body tends to be weaker. So there's a natural imbalance between the front and the back. And depending on certain job, for example, or positions or whatever the case may be, it kind of forces you, or you tend to be in one position more often than others. So I tend to see, like, for example, people at their computer have a little bit more of that hunched over shoulders, and kind of affects that. Because there tends to be even more of a focus on this, and the back is just under a lot of tension. Everything gets really, really tight, and that can lead to some discomfort later. So if you're kind of focusing on the thighs themselves, you can use some of the roller balls or the foam rollers, and literally just rolling it over the muscle. That can be helpful to actually kind of break up some of that tightness that's there. Not over the joint themselves. Not over the bones.
I've done all of that, and I go for massage regularly, and they just will not loosen up, and I'm very frustrated by that.
I can appreciate that. So it may be kind of working with a professional that's kind of helping to stretch, helping to kind of get it moving, because that's going to be the ultimate thing. Because I can almost guarantee that there's probably a difference in strength between the thighs and the hamstrings, and just kind of working on getting that better in balance will definitely help.
I'll just add here. I'll add your peanut gallery here. All right. This is Michael, by the way, everybody, from Care Medical Elite. Always appreciate Suzanne's question. Suzanne, you're always giving such great comments.
Hi, Michael.
But hi there, Suzanne. Yeah, we've actually spoken about this before, Suzanne, with the Stretch Lab and different ways to incorporate stretching into your daily routine. And I really appreciate Dr. Freitas giving that advice, because I mean, I see it all the time. Stretching really does wonders, not just for athletes and people who are into athletics and exercising to that extent, but just people that want to stay active in their day-to-day routine. It can be any demographic, any group, any age group. It can really be anybody. So incorporating that stretching will pay dividends in the long run. And Suzanne, I mean, you're always on the ball there, asking great questions and staying ahead of it. So I really appreciate that.
But I'm not getting an answer because I've been baffled by this for a long time and I can't seem to.
And let me tell you, I've spoken with Dr. Freitas personally. I struggle with similar things myself. We were just talking about my knee recently, weren't we, Dr. Freitas?
We were. I'll just kind of wrap up a little bit more of the presentation, and we'll be happy to answer more questions as they come about. This next topic is handling heavy loads. So as if a load is further away, any heavy weight, if it's further away from the actual floor of the body, it puts a little bit more stress. Holding something closer will actually make it a little bit easier. Holding it from the sides, not using the fingers, but ideally using the palms or the hands or the actual larger muscles themselves. That helps to kind of help spread out the weight, spread out the force, and makes it a little bit easier. Again, and then lifting appropriately. So kind of squatting down, picking something up. If you're bending over, there's potential for aggravating the back and things like that. But if possible, kind of slide, push, pull rather than actually lift if that's doable then. Okay. Building strong bones. Again, calcium intake is going to be important. Also magnesium and some of the other vitamins and minerals. And so those are going to be important. And kind of briefly touch on some of the green leafy vegetables, all known to have higher levels of calcium. Also dairy, milk, yogurt, broccoli, kale, figs. So it's not just the green leafy vegetables. It's not just dairy. They're all important. We can also get them set. Some fish and calcium supplements as well.
Can you overdose with calcium? Like if somebody had a calcium score and it were high, could it be connected to the amount of calcium?
It tends to be unrelated. So the calcium score is in relation to the heart, the blood vessels, and
that is
or staff. Yeah,
calcium
supplements tend to be a separate approach. Vitamin C is actually another helpful thing as well. So pick, pour, or peel. Reach for an orange. It's always going to be our preference as opposed to the juice itself, because you get a little bit of the fiber with the orange itself. Because vitamin C can actually help slow the progression of arthritis as well. So just making sure you're eating a wide variety of foods. Again, some of that anti-inflammatory diet can definitely make a big difference. Cutting back on caffeine. A cup, even a 2, that should be okay. As we're starting to get into the 3rd, 4th, or some of the patients I've seen, I just drink 2 pots of coffee a day. I'm like, oh, okay, type of thing. So you start getting to those elevated levels of caffeine that can actually impact the bone strength and everything like that. So just kind of cutting back, ideally replacing it with a little bit of water. It's always going to be a helpful thing. Taking your vitamins. Daily multivitamins can help if your diet needs some improvement. If you're doing a great job, you're eating mostly fruits, vegetables, you're eating whole grains, you're eating the lean proteins, and you're getting a wide variety of colors, you can do well without it. But if you realize that there's some areas of the diet where there's some room for improvement, a multivitamin can definitely go a long way. Or specifically focusing on calcium, vitamin K, those help build the bones. Vitamin C kind of helps repair the tissues, especially around it. Vitamin E can help with pain, and folic acid and more. So all of these vitamins that are typically found in a multivitamin can be beneficial. All right, so choosing function over fashion. So for the individuals that I need to look good, that's great. I support it. However, there can be some shoes that are made for, I'm just going to stand here, or this is a shoe that I'm going to wear to sit. I'm not going to go walking. No, that's not exactly helping promote our ultimate movement type of goal. And so making sure you're getting flexible, comfortable shoes, that's going to be a helpful thing. Squared shoes, round rock shoes, give the toes a little bit more flexibility, a little bit more room to move around. And shoes with a rubber sole give you a little bit more cushion and also help with traction so that prevents slipping and so on and so forth. Don't stomp your feet. Pounding exercises can be tough on the joints. Kind of what I briefly talked about in one of the earlier slides. Running, excessive jumping, can be great, but for those that have challenges with the joints, might not be the best of the options. So again, the lower impact joints or lower impact exercises tend to be a little better. All right. And increasing the range, again, range of motion exercises, that's going to be important. Adding weight, all of those will help tone up the muscles, help keep the ligaments flexible and strong. And then this last one, say no. The example that immediately came to mind as I was coming up with this was, I had been to friends' places and they think, oh, you're just going to be sleeping tonight in the attic. So you're going up the rickety old stairs, you're sleeping on the pull-out couch, you get the spring that goes in the back. There's times when you can just say, no thanks, I'm okay. So if it's going to affect how you're feeling and you're sore for 3 days, that's not necessarily the best option. And so if you know that there's going to be something that could negatively impact the joints, it might be something to say, thank you, I appreciate it, but not right now. And then that should be pretty much nearing the end. Some of the sources, Cleveland Clinic, Mayo Clinic, Arthritis Foundation, National Institute of Health, American Academy of Orthopedic Surgeons, American College of Rheumatology. So just a brief overview of joint health and keeping people moving. That's going to be the most important thing. There's different types of arthritis. There's different strategies to prevent it. But one of the best things that can be applied universally, moving and lowering the inflammation. I do thank you guys for your time. I thank you for the team that's on Zoom. I appreciate it. And I'd be happy to answer any questions as they come along.
When Dr. P sent out the information about your seminar, there were other types of things. And again, because I got here late, I'm sorry about that. Like I said, the traffic was horrendous, but there were different things that were mentioned about problems that you may have in ways to remediate them. Like there was something mentioned, something disc. It's probably like an artificial. Mm-hmm. Did you talk about any?
I did, yeah. A little bit on that at the beginning. So there are the supplements, chondroitin or glucosamine chondroitin, that's the most well known. It's two naturally occurring substances that put together. Works for some people doesn't get that same benefit. The hyaluronic acid and some of those other viscous substances, sometimes those can be injected. The idea is to kind of help give a little bit more cushioning and also help to stimulate the body to actually produce a little bit more.
Does that have good results, or?
People say it does, but it's, in terms of the actual studies, there's very few of the actual organizations that recommend it. It can have a little bit of benefits for the knees, but otherwise it's more iffy, I guess would be the best way of saying that. The evidence doesn't fully support that this is the greatest thing since sliced bread. But some people may get benefit from it, but on average it's most people don't seem to see as much of benefit as it was originally when it came out years ago. This was the best. This was the hottest ticket. The evidence hasn't shown that it's as much.
What about PRP?
PRP is a little bit more of an involved process because it involves drawing blood, using the centrifuge to kind of spin it down, do it again and take off a certain area, certain of the plasma that's rich in that platelets. You inject it in. Again, that has the most evidence for the knees. You inject that in. Its idea is to actually cause a little bit more injury to start, brings in the healing cells, and actually can potentially cause a little bit more of a response of regrowth. It's just a little bit more of a process and a little bit more time consuming, but that one actually has a little bit more benefit, a little bit more evidence than the.
So there's scientific evidence that is support that it can create regeneration.
Or not full regeneration, it will definitely help slow the process down. You may get a little bit of regeneration, but to expect that it's going to go back to the joints at 18 years old, that's.
But could it take somebody who was uncomfortable and say with joint pain and bring their circumstance to a tolerable level?
They could.
Do you know what the percentages are? I mean,
I have to look that up. I don't ever lie to patients or anybody, so I just don't know. So I have to look that up immediately.
thank you. Yeah.
Doctor, what about the monovisc? I think this might be what Suzanne was referencing. Is that correct, Suzanne? The monovisc injections?
Yeah, but I think that falls into the category of what he was talking about, the viscous.
Yeah, the Synvisc,
Right,
monovisc.
many years
Yeah,
ago, to
exactly.
Synvisc, and I kind of thought that probably would be an offshoot.
Yeah, exactly. They're all kind of related, some different formulations, but yeah, they're all in that same umbrella, same category.
Where did they do the plasma?
So they would be, I'm not entirely sure because I don't know if we have it here as an option because it'd be drawing blood, fitting it and doing all that stuff. That may be potentially something down in the pipeline, but as of right now, I'm not entirely sure. And I've just joined the practice recently, I'm still kind of figuring out what the situation is. I know it's been talked about, but as of right now, that's a more theoretical as opposed to an actual here. This is when we're doing this. Let's do this and set aside the time and go from there.
There are a couple of orthopedic surgeons that are in the area that do the PRP. And this is a complete aside, but you might find it interesting. I actually had, I think it was called the Frankenstein facial once, where they do the PRP into the face and it helps regenerate the skin. So, but there are Dr. Southern, Daniel Southern. I'm just very interested in medical things, and I have followed his articles about the PRP into the joints. And if you're interested, you might want to look them up online. And there's a lot of pretty interesting information about it.
I like this. I could assist.
Been here now. If I could help.
Then anything else? Anybody else? Happy to answer.
Anybody here in the Zoom? I see we have some members here, some elite members. If anybody has any questions or also just wants to, if you haven't already, introduce yourself to Dr. Freitas. You know, he's still getting accustomed to the practice. He's still fairly newer, and so he's really excited to meet all of you, get to know you by a first name basis eventually.
That's the plan.
And then I will also add, obviously, if anybody has questions, please interject. I will also add, it's great learning about the diet. I always find that to be the thing that I'm particularly interested in. We've spoken with Deb Boynton, who's our fitness coach and weight loss expert. And we've also spoken with, not just Dr. P, but other, representatives from Elite, even, Paolo Persichetti. He's actually certified and has a background in diet nutrition. So it's always great to hear the health benefits. I've heard about the Mediterranean diet so many times. It's just, it's really encouraging. I feel like everybody should eat that way. Am I right, doctor?
Got my stamp of approval. Yeah, it's hard to beat.
On the other hand, I've been very interested in that also. And there's so much that comes out on the internet and so much in books. It's really overwhelming. And to have just a nice little printout of a capsule summary of what the key points are and maybe some menu ideas would be extremely helpful.
Did he?
Yeah.
I mean, that may be something
She doesn't.
that may be something we can look into and actually split it over.
That would be a real beneficial little tool to have.
Of course, we can make that happen, Suzanne. Absolutely.
That would be great. The Mediterranean diet, Janine, there's so much out there, and my head spins when I try to just zero into something that would be simple enough to be able to kind of get the idea and then get some good ideas for some daily meal plans that you could follow that wouldn't be 20,000 ingredients you don't have.
Mm-hmm. Yeah.
I'll tell you what, we've actually done recipes and cooking tutorials with Paolo way in the past. We haven't done it in quite some time. I definitely see the value in it. He's certified in diet and nutrition, and same thing with Deb Boynton and so many of our care medical providers. They have a particular interest in diet and exercise, including Dr. Freitas. So, if that's something that you're interested in and other members are interested in, I would love to bring that to Dr. P, because I think that's a great thing to explore. Going over recipes, meal planning.
I think it's everybody's first meeting. What do I do?
We'll second that. Yeah.
Realistically, day to day.
Yeah, great point, Suzanne. I'm also so interested in how the diet affects the body. So, point well taken.
Well, get on it, Michael. Let's have our next seminar on that subject.
I'm on it.
Good boy. Thank you.
And anything else that's kind of been on the mind or anything that you're like, now I have a chance.
And there are just so many things that can benefit people if we're just presented in simple terms and in small pieces, because when you get overwhelmed with 1,000 different things, it's where do I start? What do I do? You know, and just a plain a simple day to day, I think it benefits so many people.
I agree. All right. Anything else?
Well, I'm going to close the Zoom here in just a moment. I will remind everybody, Dr. Freitas is available if you want to meet with him to discuss anything joint related. I will say on the record, I've met with him myself for my own joint related problems, and he's very knowledgeable, of course, and he's a resource to leverage. So if you ever want to speak with Dr. Freitas, you just let Janine know, and we'll get you scheduled.
Easy.
Thank you.
Happy to help as much as I can. I want people moving. That's the body's made to move, so let's get people moving.
Okay.
I do greatly appreciate the Zoom team. I greatly appreciate the audience here. It's been a pleasure. So I'm looking forward to a long, fruitful interactions journey. This is going to be fun. Let's do this.
All right, everybody.
Really appreciate it.
Signing off.
Bye.
Bye.